Good day everyone, I'm Rovilyn Catienza. For today's video, I will do oxygen inhalation. Method by which oxygen is supplemented at higher percentage than what is available in an atmospheric air. Purpose: to relieve dyspnea, to reduce or prevent hypoxemia and hypoxia, to alleviate associated with struggle to breathe. Two source of oxygen. Wall outlet oxygen cylinder. Equipment required. Assume this is oxygen connecting tube. Nasal cannula of appropriate size or oxygen mask. Modifier filled with sterile water. No smoking signboard. Oxygen cylinder and flow meter. Assume this is real equipment. Nasal cannula method. Check doctor's prescription including date, time, flow liter per minute, and methods to avoid medical error. Perform hand hygiene and wear gloves if available to prevent the spread of infection. Explain the purpose and procedure to the client, providing information foster the client cooperation and allows his or her anxiety. Assemble equipments, organization, facilities, accurate skill performance. Prepare the oxygen equipment. Attach the flow meter into the wall outlet or oxygen cylinder. Fill modifier about 1/3 with sterile water or boiled water. Modification prevent drying of the nasal mucosa. Move the patient in comfortable position. Attach the flow meter into the wall, outlet, or oxygen cylinder. Fill the modifier about 1/3 with sterile water or boiled water. Modification prevent drying of nasal mucosa. Attach the cannula with connecting tubing to the adapter on the modifier. Test the flow by setting flow meter at 2 to 3 liter per minute and check the flow on the hand. Adjust the flow meter and test the flow in the hand. Testing flow before use is needed to provide prescribed oxygen to the client. Adjust the flow meter setting to the ordered flow rate. The flow rate via the cannula should not exceed 61 per minute. Higher rate may cause excess drying of nasal mucosa. Insert the cannula into the client nostril. Adjust the tubing behind the client ears and slide the plastic adapter under the client chin until she or he is comfortable. Proper position allows obstructed oxygen flow and assists the client respiration. Maintain sufficient slack in oxygen tubing to prevent the tubing from getting out the place accidentally. Encourage the client to breathe through the nose, inhale through the mouth, and expire from the mouth. Breathe through the nose, inhale more oxygen into the trachea, which is less likely to be exhaled through the mouth. Initiate oxygen flow. Maintain doctor's prescription and avoid oxygen toxicity. Assess the client response to the oxygen and comfort level. Anxiety increase the demand for oxygen, and this time I remove this nasal cannula and I will show you how to apply the oxygen mask. Assume this is the real oxygen mask. Apply the mask, guide the elastic over the top of the client's head. Bring strap down to the adjust below the client's ears. This position will hold the mask most firmly. Gently but firmly. Fold the strap extension to the center of the mask on the client's face with a tight seal. The seal prevents leaks as much as possible. Make sure that the client is comfortable. Comfort helps relieve apprehension and lower oxygen need. We will do the same way the procedure. Adjust the flow rate and put the nasal cannula. Okay, ano daw yun? Hindi. Wait lang. We will do the same procedure in nasal cannula. And we put the connecting tubing. And now, dispose the gloves if you were and perform hand hygiene again. Place no smoking signboard at entry into the room. The sign warns the client and visitor that smoking is prohibited because oxygen is combustible. Document the following: date, time, method, flow rate, respiratory condition, and response to oxygen. Documentation provides coordination of care. That's all my performance in oxygen inhalation. Thank you.